Hey, what's up, guys? All right, we're going to continue our talk on taking and empowering ourselves to relieve ourselves of pain through tissue maintenance. And I want this to stay along the lines of being able to take care of ourselves with minimal equipment. Okay, so welcome to the party. If you're just joining us, we're working on what's called mobility. This is being able to express full range of motion at a joint or letting our muscle tissues actually move through a full range of motion. They're not short or restricted or matted down, and we're basically teaching you ways to overcome any of those issues that might be causing you pain or limiting your movements. And again, we can only move as best as our tissue is healthy and our joints are able to move well and our kind of bony structure is aligned. So we're in the Casa de Craft today again, and I wanted to just go through now. Last time, if you didn't see the video on the foot, we started on dealing with kind of foot pain and how it manifests up into pain of like plantar fasciitis, so just pain on the bottom of the foot here. And now I want to lead up to kind of talking about our hips today. Okay, so guys, if you have issues with the feet, we go back, check that video. But some of the things we talked about were like these knees dropping in, where we have this force that comes down right on the instep of the foot here, that flat foot, that low arch. And we want to basically, what that'll do is that'll create a lot of tension up here in the quads, in the back of the knees. We're going to find that the forces kind of go in places we don't want. So I want to teach you ways to be able to open up your hips. We're kind of working upstream now. We want to learn how to take care of our hips so that we can get into a full squat. We have no issues here. We still have a nice little arch in our foot, and we're able to move effectively. Okay, so the first thing that we've seen is typically, right, if I'm a normal human and I'm seated all the time, right, here I am seated, what tends to happen when I sit is this kind of shortening of the front of my body. And then if you look behind, right, like my shoulders, they kind of round forward and my low back kind of kicks out. Not very healthy. So what we want to do, guys, is first of all, we want to be aware of our posture, okay? And then we're going to start thinking about, well, if I'm in this seated position where my hips are kind of, right, they're kind of like tucked under, that creates a very short hip flexor here, and it kind of shortens all the way through the quad here. And so what we want to do is we want to open that up, and all you really need, you guys, is like a bed or a bench or something to kick your foot up on. So what we're going to do first is going to be drop that foot up onto the bench. Okay, we're going to hook the toe. We're going to drive our knee back underneath that foot. We're going to be in this kind of lunge position here. Squeeze your butt, raise that chest up, okay? So again, we're staying organized up top, and we are opening up this hip flexor all the way through. So now we know we're opening this up. It's going to be kind of gnarly. 2 minutes per side, okay? 2 minutes per side. Open up that hip flexor. Keep trying to drive it forward. If you're unable to even get up, though, guys, if you're that tight, then you're just going to kind of stay down in this lunge position. Keep squeezing your butt and try to drive your hips to the floor, okay? So that's position one. We're going to get into the couch stretch for 2 minutes per side. Now, let's talk about, again, simple things we can do to kind of manage these tissues. So if we take a look here, kind of at what we're dealing with, right? The knee, if we have pain in the knee, guys, what happens sometimes is this joint, it gets compressed, okay? So we have the upper and lower leg coming together. This thing kind of gets compressed, and it's kind of like the hinge of a door. If there's not a lot of wiggle room, right? If you have a door that's hanging and it's bent down, there's going to be some grinding there, and you're going to have a little pile of dust from that door hinge after several opening and clothings. So we want to fix that. So one of the things we can do to open up the joint of the knee itself is, again, grab your trusty pain ball or myofascial release tool. We're going to stick that into this kind of behind the knee gap here. So it's not directly under, we're not going directly under here. We're kind of off to the side, okay? So we're just off to the side. And then what we're going to do is we're going to have to get up next to like a wall, okay? And again, we're going to take this pain ball, put it right here on the side, and we're going to use the wall to keep our body and hips in a nice neutral position. and then I'm gonna pull that leg in, okay? And this ball is now creating a flexion gap. So by flexing the knee, I'm trying to force open a gap in the joint. Sounds scary, sounds freaky, not freaky, actually feels really good. Just opening up that joint, we're gonna spend 2 minutes here. Once I'm done here, guys, I'm actually gonna try to hit on the now inside of that leg as well. And this one's kind of gnarly because you might get a little calf mobility going on here, okay? But these flexion gapping tools, using your pain ball is a good one. And that'll just restore some of that natural joint health that you might be missing, okay? Next thing you want to focus on is going to be then, fix the light here, I know it's kind of crazy, stay with me, is right up along the back side, if I can kind of show you here. So when we squat, okay, oftentimes right along in here, right up the calf on the inside of the leg here, kind of going up behind the knee. If you just take your thumb and you just start to push, okay, what you're going to find is probably some really gnarly tissue. It's kind of like, here's that calf muscle. I know I have invisible calves, but right on the edge of it here, this stuff gets really tight and short, just because of the way that we don't really go through a full range of motion all the time with the lower leg. And so I want you guys to get in here with your thumb. Here's kind of like your shin bone up top, right? You're going to come down just a little bit and start pushing and pushing, and you're peeling this tissue off downward, okay? So we're peeling this tissue off downward. I want you to spend 2 minutes per leg peeling this tissue off downward. Now, if that's not enough for you, again, go ahead, take your ball, feel free to push it in. We're going to tack and floss that tissue. I just find it more effective when I use the old thumb, all right? So I'm going to want you to peel that tissue off, okay? So we've got couch stretch, we've got flexion gapping, and then we're peeling off some of those tissues behind the knee, which can, essentially, when these are short, they end up pulling the knee into that unflexed position, meaning like it creates the, it removes that space that we're trying to achieve with that flexion gapping, okay? The last thing we want to focus on then, guys, is going to be pigeon stretch. So pigeon, of course, is not new if you've been around the block for any amount of time, right? What we're trying to do, guys, is get our front leg up at about 90 degrees, and then our back leg, we're simply extending backwards, trying to sink into this flexion external rotation position here of the upper body, okay? So from here, you can see, nice position, all right? And I would just simply try to sink down into this 2 minutes per side. Now, if that's too much for you, the nice thing you can use is that same bench you were on, okay? This is a kind of a way to modify this. So get up on a box, get up on a couch, whatever you need to do, get that leg up, get that leg up near the edge, okay? So I'm up near the edge, and now, because of the space below, I can sink my hips down and get that nice stretch along the outside of my hip here, okay? So I'm kind of using this bench to block my leg, and now I can sink my hip down into it and get a good full range of motion there. So that would be a elevated pigeon stretch for you. I know we talk fast, we got a lot to get done. Hope this helps you guys remove pain. Should take you about 10-15 minutes today. Get on it, let me know if you have any questions, post up if it helped. Have a great day, we'll see you soon, bye.